Your Excellency, President Ngweso, Your Excellency, Prime Minister Makoso, Honorable Minister Mokoki, Honorable Minister Dikoloti, my sister Regional Director Shidi Moeti, and my other sister AU Health Affairs, Humanitarian Affairs, Commissioner Minate Samate Sisoma, Honorable Ministers and Heads of Delegation, dear colleagues and friends. Good morning, bonjour, and it's an honor to be back in Brazzaville. And I like to join my sister in saying, Mbote. I thank Your Excellency, your government, and the people of the Republic of Congo for your continued hospitality in hosting the WHO Regional Office for Africa. I also congratulate you for your leadership on health regionally and at home. When I was here, you remember, Your Excellency, 5 years ago, we discussed the importance of prioritizing primary health care at the foundation of universal health coverage. I'm very encouraged that under Your Excellency's leadership, that's exactly what you have done. District health systems have been strengthened. Access to essential medicines is improving. The capacity of the health workforce is increasing. And community health committees are functioning effectively. As a result, service utilization is improving, and maternal and infant mortality are going down. WHO is proud that we have been able to support you on this journey, and we will continue to support you, just as we will continue to support every member state of our continent. I would also like to use this opportunity to thank you for the 50% increase in funding to WHO that was announced by Minister Mokoki earlier. Thank you so much, Your Excellency. The people of our great continent face many threats to health, both communicable and non-communicable. The most recent of those is the outbreak of Mpox, over which I declared a public health emergency of international concern less than 2 weeks ago. So far this year, more than 18,000 suspected cases of Mpox with 615 deaths have been reported in the Democratic Republic of the Congo alone, already exceeding last year's total, which was itself a record. Of particular concern is the rapid spread of a new strain of the virus that causes Mpox, called Clade 1b, in the country's east. In the past month, more than 220 cases of Clade 1b have also been confirmed in 4 countries neighboring DRC, which had not reported Mpox before: Burundi, Kenya, Rwanda, and Uganda. Last week, cases of Clade 1b were also reported in Sweden and Thailand, in people with a travel history from affected countries. But Clade 1b is not our only concern. Cases of other clades have also been reported this year in Western DRC, as well as in Cameroon, the Central African Republic, Cote d'Ivoire, Liberia, Nigeria, the Republic of the Congo, and South Africa. It's a complex and dynamic picture, and responding to each of these outbreaks and bringing them under control will require a complex, comprehensive, and coordinated international response. That's why I decided to declare a public health emergency of international concern. Since my declaration on the 14th of August, WHO has been working with the affected countries and others at risk through our country and regional offices, as well as with partners including the Africa CDC, NGOs, civil society, and more. Last Monday, I issued temporary recommendations under the international health regulations for countries affected by and at risk of Mpox. Together with our partners, we have developed a global Mpox strategic preparedness and response plan, which we shared with all member states on Friday, and it was published earlier today. The plan requires $135 million over the next 6 months to bring these outbreaks under control through comprehensive surveillance and response, minimizing zoonotic transmission, empowering communities to participate actively in outbreak prevention and control, and advancing research and equitable access to medical countermeasures, including vaccines. On Friday, we received the information we needed from one of the manufacturers to evaluate its vaccine. We expect to issue an emergency use listing within next 3 weeks. In the meantime, I have given the green light to the Gavi and UNICEF to proceed with procurement of vaccines pending the EUL decision. We will provide more information during the Mpox session on Wednesday or after tomorrow. I'm confident that the leadership of the affected countries, the support of WHO at all 3 levels, and the partnership of the Africa CDC and others, we can bring this outbreak under control quickly, just as we have with many other outbreaks in recent years. We have learned valuable lessons from our experiences with Ebola, COVID-19, and more. Indeed, improvements in health emergency preparedness and response have been a defining feature of the transformation of the African Regional Office under the leadership of my sister, Dr. Shidi Moeti. Nevertheless, weaknesses remain in the health security architecture globally and in Africa, so I'm pleased to see that your agenda this week includes consideration of an innovative approach to strengthening the architecture, and look forward to participate in that discussion. As you know, member states made significant steps toward strengthening health emergency preparedness, prevention, and response at this year's World Health Assembly. The adoption of a set of amendments to the international health regulations and the agreement to conclude negotiations of the WHO pandemic agreement before next year's assembly or sooner are major achievements. By the way, I would like to use this opportunity to thank the Honorable Minister of Botswana, Dr. Edwin Dikolotti, for his leadership during this very historic time. And I urge all member states of the African region to continue to engage actively in those negotiations to ensure a strong agreement that truly makes the region safer. Strengthening WHO support for countries to prevent, prepare for, and respond to health emergencies has been a key part of our transformation over the past 7 years. Based on ideas from member states, partners, and our own staff, we launched the most ambitious reforms in the organization's history with more than 50 initiatives in 2018. We have made significant changes to our business processes, our operating model, our approach to partnerships, our culture, and more. The transformation has been focused on making WHO more efficient, effective, and results-oriented. That approach was embodied in a bold new strategy, the 13th General Program of Work. GPW 13 was the first of its kind in the history of our organization, with measurable targets and clear indicators to support countries on the road towards the health-related SDGs. Although we have made progress down that road together, it has not been far enough or fast enough. Even without the impact of the COVID-19 pandemic, we would have been well short of our goals, as you know. The lessons learned from GPW 13 have now been incorporated into GPW 14, which member states adopted at this year's World Health Assembly. GPW 14 incorporates lessons from the past and the realities of the present and our aspirations for the future. It's based on a clear mission to promote, provide, and protect health and well-being for all people in all countries. It's based on a clear mission to promote, provide, and to protect, as I said earlier, and to mobilize the resources we need to implement GPW 14. We have launched the first WHO investment round. The investment round is itself part of the WHO transformation as the fourth pillar of our long-term plan to make WHO more sustainably financed, as the investment round as part of the assessed contribution. And it's about ensuring WHO is fully funded and that the funding we receive is more flexible, predictable, and resilient. I thank member states from the African region for the exceptional leadership you have demonstrated in advocating for sustainable financing for WHO and for the investment round. I would especially like to thank His Excellency, President Mohamed Ould Ghazouani, for his support for the investment round as Chair of the African Union and for honoring us with his presence at this year's World Health Assembly. Excellencies, dear colleagues and friends, I leave you with two requests. First, I urge all member states to engage actively in negotiations for the pandemic agreement and to ensure negotiations are completed by the end of this year. And second, I urge all member states and partners to participate in the investment round. Every member state can contribute something within its means, and every contribution makes a difference, whatever the amount. I urge all of you to continue to advocate for the investment round, because ultimately the investment round is about you, our member states, and the people we serve. Investments in a strong and sustainably financed WHO are investments in a healthier Africa. And I was very glad in their speech Minister Mokoki and Minister Nicolotti have stressed the importance of sustainably financing WHO. And I'm really glad to see our Africa taking the lead in advocating for the financing of WHO. And of course, as the first DG from Africa, I will need your continued support, and that's exactly what you're doing, and I'm proud. Merci beaucoup. As always, you have an important agenda this week. You will consider important frameworks on diabetes, health data, climate resilient and sustainable health systems, local production, and food safety. And tomorrow, you will elect a new regional director, as my sister Shidi indicated earlier. Whomever you choose faces one of the most difficult but rewarding jobs in global health. It's a position that demands principled leadership, unflinching determination, clear vision, genuine innovation, technical expertise, and political acumen. It's a tall order. Whomever you elect will need your full and ongoing support, like you did for me. And you remember, especially during the COVID pandemic, when WHO was, what do they call it? In the eye of the storm. And all the support made a difference in helping me to steer forward. And our regional directors also need the same support. And whomever you choose has big shoes to fill and a hard act to follow. Dr. Shidi Moeti exemplifies all of the qualities I just listed. She is one of the most formidable health professionals I have ever had the privilege to call my colleague, which I later on upgraded to my sister. She is not afraid to tell you exactly what she thinks, but she does it because she cares. She cares deeply about the people of our continent and the people of the regional and country offices. She believes that the people of Africa deserve nothing but her best. And that's what she has given for the past 10 years. My sister Shidi, we all owe you an immense debt of gratitude for everything you have done, but also for who you are. Thank you for the example you have set and the legacy you have left. We will all miss you. But as we say, once WHO, always WHO. So you cannot hide from us, and we will continue to exploit you, exploit in a positive sense. I wish you every blessing for the next chapter of your life, and much joy wherever life's journey leads you. Excellencies, dear colleagues and friends, please join me in standing to express your appreciation for our sister and your regional director, Dr. Shidi Moeti. Thank you. Thank you so much. Thank you so much. If it's put in gold, I think it will be a gold, like Nicoloti say, the 200 meters. By the way, I was in the middle of the stadium cheering for our brother when he got the first gold, not for Botswana, but for our continent. And I was so proud. So thank you for mentioning him. And thank you, Your Excellencies. Thank you.
Distinguished invités,
Distinguished guests, ladies and gentlemen, in the introduction, we said that His Excellency, the President of the Republic and Head of State, during this ceremony shall be presented an award by the World Health Organization. We therefore respectfully invite the Regional Director to join us to give us the citation of the President.
Merci beaucoup.
Thank you very much. The World Health Organization today recognizes His Excellency President Denis Sassou Nguesso, President of the Republic of Congo. His Excellency, the President, has made notable contributions to promoting health in the African region in general, and in this country, the Republic of Congo in particular. He has continued the tradition of hosting the WHO regional office in Brazzaville, which started in 1952 and supported the work of WHO across the entire region. He has championed efforts to accelerate progress towards universal health coverage. His Excellency has all along been a champion of maternal health and guaranteed national investments for the reduction of maternal mortality. He has also embraced the fight against counterfeit medicines at the continental level. He has also demonstrated strong leadership in reforestation and protecting biodiversity, as I said. His Excellency, President Denis Sassou Nguesso, is without question a most deserving recipient of this award from the World Health Organization. I thank you.
nous invitons
We most respectfully would like to invite His Excellency, the President of the Republic, to come to the stage and receive his award.